All right, imagine your mouth like it's on fire all the time, and you have no idea why. It just simply burns.
That's a painful reality for millions of people who suffer from burning mouth syndrome. It's a mysterious condition. The pain is severe, chronic, and unrelenting, yet it's kind of tough to diagnose and treat.
Yeah, specialists say it can literally ruin the quality of life for sufferers. ABC 2 News' Megan Knight has a look at this confusing condition.
Her lips, tongue, and mouth appear just fine, but soon after Kelly Rourke wakes up each and every morning, the burning sets in.
When I say burning, I don't mean like a scratchy throat or a sore throat. I mean burning.
Kelly has suffered with the horrendous heat non-stop for more than 5 years. She had dental work prior to the pain, but her dentist couldn't pinpoint an exact cause. What followed was a flurry of specialists, tests, and medications that didn't work for her. Finally, a diagnosis: burning mouth syndrome, or BMS.
It started out for me with burning in the back of the throat up into the upper back of the palate.
And now it has spread to her tongue. Doctors diagnosed BMS by ruling out everything else, including nerve damage, oral yeast infections, and diabetes. Harvard oral surgeon Sukbin Wu says it's a tricky condition.
You can work the patient up extensively with blood work. You can examine the patient very carefully, and you're really going to see nothing.
It impacts more women than men. Patients may get a severely dry mouth, but it's the pain that's tough to describe. They say BMS feels like scalding coffee searing the inside of their mouth, the spiciest food ever tried times 10, or even like actual fire.
It gets bigger and bigger and bigger through the day. The only thing that relieves it is eating, drinking, or crying for me.
Relief during eating is common, says Dr. Andres Pinto, who researches burning mouth syndrome. He says there's no definitive cause, but there are theories.
The first one is abnormality in the nerve fibers in the mouth. The other theory is that there is central nervous system abnormality or a brain abnormality in terms of the chemicals in the brain.
There's also no cure. Doctors help patients manage the pain with 2 drugs typically prescribed for other conditions, one to prevent seizures, the other from anxiety. Kelly is on one of them.
By 10 a.m., I am ready for some medicine. That will take the edge off for me.
Some patients also use special mouthwashes and topical treatments. Kelly says she has suffered depression because of her chronic pain. She's hoping for a breakthrough on a cure soon to help her and the millions of others who can't bear to swallow their pain another day.
I think the doctors have done what they can at this point. They look at me pityingly and say, there's really nothing else to try. Good luck to you.
While BMS never actually goes away, Dr. Wu says for many patients, the pain dulls an average of 7 years after their first symptoms. Megan Knight, ABC 2 News.
There's also something called oral burning, which is not actual BMS, but goes away over time. So if you've been suffering from any of these symptoms, it's a good idea to consult with your dentist.